come together, talk about a certain topic, and it's how we can actually just be able to bridge the gap and see how we can get conversations flowing that we probably wouldn't have if there's no other forum for it. So without any further delays, I'm just going to introduce our senior dentists first, or I'm going to say a little bit about them and they can add. So first start with Prof. Prof. Youngapal, I've known personally for too long. He was a lecturer when I was an undergrad at Wits. He's then gone on to be the dean at the University of Western Cape. But prior to that, he was also in private practice and has had experience in pretty much all spheres of dentistry in South Africa, private practice, academics, where he has excelled to the point where he's a dean. Prof, anything you'd like to add to that?
Thank you very much, Nate. My name is Jeff Yengupal. I'm the dean here at the Faculty of Dentistry, University of the Western Cape. For me, it's just such an honor to actually share the platform with the young students. And it's so fantastic to see the growth and development of these young professionals now, most students. And it all goes well for the profession. And then this is what we're looking for the young dentists to take leadership roles and to move dentistry into the next phase. And we have so much potential in this country, but I'll speak to all this as we move along. But thank you for inviting me, and I'm very happy to share my knowledge and experience to the upcoming and the young dentists that are joining this forum today. Thank you.
Thanks. And then the next senior dentist we have is Dr. Sandrine Gandu. I've known Sandrine also for a few years. We sit on the same branch at SADA level. I do know that she's a very successful private practitioner dentist, and where she has quite a big practice here, Sandrine, here in Johannesburg. Anything, Sandrine, you'd like to add to that as well?
Thanks so much, Nate. I think I'd like to echo what Prof said. It really is such an honor to be here. And I'm also very excited to see what the future of dentistry is. And I look forward to sharing any sort of pearls of wisdoms and just to help guide you guys to find your way and to keep our profession going ever higher. So, and thanks for that. I didn't know I was that great a dentist, Nate. I was wondering who you were talking about. Thank you so much.
I hear things. And then next up we have Masuda Esop, also an ex-Wits alumni, also starting to make her big punch in the world, has her own practice, as well as being a mother of twins, which I think is probably harder than any of us can imagine. Anything else you'd like to add to that, Masuda?
I think that about sums me up. Thank you. This is actually such a great privilege to be a part of SADA and be a part of the Young Dentist Council. It's we want to keep the enthusiasm amongst dentists alive, and this panel is here to bridge that gap, and hopefully we get to do a bit more of that tonight. So yeah, thank you for having me on the panel.
Amazing. And also we have Adnil Koch, who is also a young dentist from the Western Cape. He's very good at endodontics from what I see on Instagram. He's also very good at photography and has very good practical skills and conveying complicated things in a simple way. So I think he'll add a lot to the panel. Adnil, anything you'd like to add?
Oh, no, thank you for having me. I'm very excited to share tonight. As I always say, before I start any of my lectures, I am Instagram famous, but I'm also rich on Monopoly. So yeah, it's the same thing.
Okay, and then we have a special edition this year, which we normally don't have in this, and it's involvement from students themselves. So we have two students with us tonight, Katleo and Jamila, who are Katleo's in second year and Jamila in final year, if I'm not mistaken, Jamila. And they're going to be kicking it off with and introducing themselves first, and then they're going to start kicking off some of the questions. So they're going to first be addressed towards the senior dentists, but anyone can jump in if there is something they can add to the conversation. Yeah. So Katleo, do you want to start off?
I'm Katlon Sakana. I am a second-year dentist at the University of the Witwatersrand, And I am just really passionate about getting to know this profession, especially from people who are already within it and have gotten their qualifications. I think it's very important to bridge the gap between both generations. And I'm just very excited to be here. And yeah, I'm also the Deputy Secretary General of SADSA and the chairperson of the VITS Charter of SADSA. So thank you for having me.
Jamila? You've got no volume there.
Volume.
There you go. There.
All right. Okay, cool. My name is Jamila Ramatina. I am currently a final year at the University of Pretoria, and I'm serving as the deputy president of the SADSA National. And yeah, I don't know what much more to say about me. Just glad I'm here with people who can answer a lot of questions for us.
Perfect. Thank you, Jamila. Would you like to ask your first question whilst you have the mic?
I don't know if I have the question that I have. So since I'm in final year and soon going to be part of the working class and a graduate soon, hopefully, fingers crossed. I wanted to ask the much I don't want to say older, but much more experienced dentists about when they finished, like when they graduated, after they graduated, what was their biggest shock out there? Like, what was something that you got out there and it was like, oh my God, what is this? So yeah, that's my first question.
Okay, Sandrine, do you want to take the lead there?
Sure. All the best, Jamila. I'm definitely going to be crossing fingers, toes, and everything for you. Um, there's actually quite a lot of things because we've been having quite a few conversations the last couple of weeks and months with a few comserves, and it brings back so many memories. I think the hardest thing for me was to be able to just work unsupervised because you kind of just have a few patients and there's always somebody that you can ask. And to make matters worse, during my comserve, I really was unsupervised. I literally had a clinic for myself. So definitely wouldn't recommend that. I hope it's a lot better managed now than it was back then. And then post that, it was just coming from a space where you were literally just extracting all the time to then get back into, because I had to go straight into private practice after that, and then to just bring your level up when you're still trying to figure out, do you actually even know what you're doing? And I think as we go along, there's a few other things that we'll talk about, like so many other things that are so pertinent to not just even running a practice, because that comes later, but even just to be able to locum under somebody. So many things that we're not exposed to at undergrad level. And then all of a sudden you're thrown into this deep end of the pool and you need to sort of, just like sink or swim and try and figure out. So definitely, I think finding somebody who can sort of mentor you and help you through that was key for me. And I had that in quite a few reps that took me under their wings, and also the people that I was working with that took me under their wings to also just give you that confidence. And then you definitely learn. I'm still learning. I'm still asking questions 20 years later because it really is about just getting better. And as long as you just love it and you open to the fact that you don't know everything, I think that's all you need to know. So don't be scared. It is going to be quite a deep thing, but just like, breathe and go in.
Prof?
Thank you. But I think let me start by saying a few words about the training aspect. So dentistry is an ever-changing profession, and the word that I want to use tonight is fit for purpose. So in the traditional training platform, you would work and in a platform run by province, usually. And the focus of province is to provide primary healthcare services to the communities, the poorer communities where access is an issue. So therefore, in your training, you do lots of extractions, you do lots of basic fillings and this and that. But the high-end treatment, like the endo and the implants and the digital stuff, I find is lacking. And why is that important? That's important because 99% of our graduates end up in the sector, in the private sector, not working really for government. There's no post there. So we got to start making our students fit for purpose. So at the University of the Western Cape, we've been on this technology drive in the last 3 years. I think we spent well over 25 million. So currently, we're the only school in the country that's teaching digital scanning and treatment planning in the undergraduate program. Last year, for example, our fourth years produced 1,000 crowns digitally in-house. Not only did we save the province millions of rands, but we are, we're getting our students ready for the realities outside there. The other thing I just want to put out there to you, for example, is implants. Who places most of the implants there in the private sector? It's not the specialists, it's dentists. Where are they learning this? Because none of the dental schools are teaching it. They are learning it on weekend courses and this and that. So if you really want to get your students ready and fit for purpose and ready for the realities, you've got to introduce the things. So we'll sign an MOU with Southern Implants, for example, and they're going to give us 200 implants a year. And we're going to start, I think, in the next year, introducing clinical implant training in the undergraduate program. So we, from the university, then the other thing I must just clarify here, our competition is not WITS and SMU and UP. We're too small to play those silly games. We may want to start the thing, but so the idea is to share. I'm also the chair of the South African Committee of Dental Deans, to share our experiences and try and also help the other dental schools that are struggling. But all this is happening simply because we are finding the funding to do that. So if you had to rely on province, for example, to buy a scanner, which costs like R1 million, it's going to take them 10 years to get 10. So you've got to be different and differentiate in terms of how you're going to get this funding. And I think the time has come for two things. The universities have got to partner with the private sector. 20 years ago, if you wanted to see all the fancy toys, you came to university, because I don't know why we had the money, but we had the money for those toys. But now, if you want to see the fancy toys, you go into the private sector. So we're going to now link up with the private sector in the next few years at University of Western Cape. I'm telling the young students here also, because that's what you need to go and say to the leadership in your school. Partner with the guys that have the resources. Partner with the organizations that can fund you so that you can make your training more fit for purpose. So when you go into the world of private sector, you're not going to be spending the whole day doing extraction. You certainly, the patients are going to ask for the high-end treatment that our colleagues Nate and Dr. Masuda are doing in their practices, and maybe they can tell you what a change it is from what we taught in dental school to the realities of working outside. And we've got to not shy away from the realities. Endodontics is another good example. If you look at a proper endodontic practice, you will see how different it is from your background in terms of what was trained, you received in your training. But there's nothing wrong with that, because remember, as dental training institution, we are providing you with the background or the basics. The idea is when you go out in the world of practice, you find your niche and you develop yourself and you get in the technologies that are aligned to that. So I just want to say one more thing. Gone are the days when you could really be a generalist, so to speak. You got to choose your field, and you're going to invest in the technology linked to that field. So Dr. Koch here is in endodontics. You go into an endodontic practice, you'll see their high-tech tools and toys that they have there related to that specialty. And you focus on that. And that's where the differentiation, if you want to be an aesthetic dentist, you see, for example, Mark Boys, go to implants, look in Johannesburg, there's Faiz Ahmed from WITS, look at his practice. I can name names for you, but that's the way our profession is going. And when you're a student, you need to then develop your niche areas that you'd like to specialize. And as soon as you graduate, find the time, find the programs, and find the extra training. The universities are allowing it now to focus on those areas. And I think that's when you will start enjoying the world of private practice. And it's very rewarding also financially. I think that's the kind of advice I would give to the younger generation and the dentists that are still out there thinking that the world of general dentistry is all about being general. If you really want to be successful, you need to start focusing and thinking about your niche areas of specialization. Thank you.
I love that. Master Admiral, can you add anything? Do you want to add anything? No?
From yeah. Can you hear me?
Okay. Yeah.
So just on that base, it was just about like what do you expect or what could you be afraid of? And for me, what I found is that when we went into the real world, it was I actually remember Prof. Yengerbal telling us this, that he gave us this lecture, and he's like, you think you're gonna go in and like you going from earning like 0 rands to earning lots of money, and then you want to blow it on really silly stuff. Do not do that. So yeah, my advice would be save your money, because just like maybe Dr. Sandrine, where you have to invest into private practice straight after ComServe, you are going to need that leg to fall back on. And the other thing is that, like Prof. Yengerbal echoed about finding a niche. Whether you find your niche in undergrad is just your springboard. You know, you get your feet wet, but when you out in the real world, in private practice is where you actually see and where you get to develop your niche a whole lot better. So adding like extra training courses where you can, and just keep growing in your free time so that you can give your patients the best possible care that they deserve, and that will be rewarding for you, because you're not going to have those sleepless nights about did I do something wrong or right? So those two things, where save your money because you feel like you're earning lots of money, but out in the real world, it's actually not that much. And when you have real bills to pay, and then investing in yourself, whether it's you found your passion in undergrad and you want to hone that skill in later, or just investing in yourself once you're in private practice, those two things, it will shine through in your work, especially since both the students mentioned how passionate they were about the field. It will shine through in their work, and then hopefully it will lead to more patients, because more patients come from more than being Instagram famous or anything like that. Patients actually come from word of mouth, and it's so rewarding to be like, hey, I actually was referred to you because somebody had a great experience with you. That is one of the most rewarding things you will experience in private practice. So yeah, that's my sonnet.
Adnan?
Oh, yeah, I'll just add shortly. I think for me, the biggest shock was, when you graduate, you obviously have your quotas. You get told that you're now clinically competent and you can go out into the world and you can do dentistry. But then for me, it was realizing that competence doesn't necessarily guarantee confidence clinically. And then walking into the private sector from ComServe was actually the biggest shock for me, not from being a student into ComServe. Then it's the sudden awareness that you are the final stop. There's no supervisor coming to double check your work. No one's coming to rescue you mid-procedure. There's a shift from being a student to being the primary decision maker. And it was jarring, but also deeply empowering for me. Because then I realized that the responsibility was on me, and the responsibility was weighty, in order to help a patient in pain, or in order to help a patient who is battling with their aesthetics. But yeah, it's just the biggest shock would be just taking the theory and academia of being an undergrad student and then turning that into clinical mastery. Big challenge, but I'm sure you guys are up for it. Yeah.
Thank you. So there is one point I would like to add to this as well. For me, the biggest shock was actually a little bit of everything. But the most profound thing I found is when I actually found how expensive materials are. And as students, we used to waste so much. Like, I took an imprudent 4 incomes, so when you start doing that in private practice, you make negative money, you lose money, you bleed money. So I think the biggest shock for me was actually how expensive even something as simple as composite resin. And you know, I always make a joke saying my first filling cost me R1 million, because it's not just the material, it's the equipment, it's this, it's that, it's procuring property, it's getting this, it's getting that, it's all the other add-ons that also add to it. So I think for me, the biggest thing wasn't only just like what Monsieur was saying. You think you're earning a lot of money in ComServe, yes, it is, but you're not going to earn that in your first year of private, unless you manage to actually even your first 3 years in most practices. So often we think, oh, cool, I can go buy that nice German vehicle. Don't. In summary, you can, but I'll be that old uncle that says, I told you so. Okay. Katleo, question from your side?
Yes, so on the topic of just expensive materials and just the gap between having access to those materials and not having access, private versus public, how do us as dental students as well as dental professionals as a whole bridge the gap between innovation and accessibility? Because obviously private sector has more access to all these things and it's more financially stronger than the public sector. So how would we bridge the gap to ensure that because someone is less underprivileged or because they live in an area where it's not as developed, to ensure that they would get the same access as someone who does have means to get all these fancy equipment and procedures?
Prof, would you like to lead?
So, I mean, you're asking an interesting question, but it requires a little bit of introspection in terms of your approach and what do you want and what do you value and what do you want to give back. The fact that you enter university puts you immediately in the top 2% of people in this country. So you're privileged. If you look at the inequalities in our country, let's use a basic example. If you compare the lowest paid public servant or public worker, state worker in the country, which is a cleaner. If you're a cleaner in this country and you're earning a salary, that puts you immediately in the top 20% of earners in the country. So the gap between the haves and the have-not is huge. You come from a background where you know what it is to be poor. You've been privileged enough to given the opportunity to train in a profession that guarantees you status, wealth, and I can assure you that everybody that comes after you will come to university. So you've changed, there's a generational change. And this is then also comes back to my field, community dentistry, where you could then also got to, almost understand how privileged you are and decide whether you want to contribute to the development of those less fortunate then. So there's nothing, so don't feel guilty about making money. But what you should do is give a portion of your time for that other sector and give back. And yeah, those that have money, you can charge you can go up and charge. You don't have a limit. But I mean, I used to do that when I was in private practice. I used to do wisdoms for 30 Rand, 40 Rand, just to cover the cost of the injection. But that was my contribution to my fellow colleagues. So there are ways you can contribute. Yeah, I mean, we rely on the state for everything. I mean, remember the state dentistry, the reality, dentistry is not a problem. And the resource and dentistry is one of the most expensive professions to train and one of the most expensive services to deliver. A doctor has got a bag, he can make a difference. We need all this capital expensive equipment. And then when it breaks, it takes 6 months. But you gotta sit, you guys in comm service will know that when you go into the rural areas or the smaller areas, you are the most senior person there, and you'll sit in these committees where they discuss resources and resource allocation. So you now got to justify why you need 10,000 Rand for a handpiece that needs to be changed versus 10,000 Rand for a feeding program in that area. So these inequalities exist. The state is overloaded, waiting list area. So you got to decide from your perspective. You say you come from that kind of community, you want to go back and give back, so give back. Spend a portion of it. Nothing stopping you from going to a local school, do a basic DMFT, get a sense of what is happening, what's not happening, what should be happening, and do your bit for the country. But also make enough time for you to also, because this is a business, dentistry is a business. You need to earn a living. You've been a huge investment in you. I think it costs, your student loans, parents are waiting, black tax, whatever you want to call it. Everything's there waiting for you. Everybody wants a portion of it because you're a professional. So just make time for those things and make time for yourself. But that's a question we'll talk about also.
Sandri?
I wholeheartedly agree with Prof once again. So the reason why I went straight into earning my own private practice was it was so difficult for us to actually be able to even get a locum when we finished with our ComServe. It was very difficult to be able to actually just get somebody to give you that chance to try. And so I remember when my parents sort of agreed to loan me the money to start versus just going to the bank. Because back in the days when I did my ComServe, we earned peanuts. You guys are like living large these days. We literally earned peanuts. If I wasn't living in my parents' flat, I don't think I would have actually even survived that year. And so my parents are like, you know what they say, opposites attract. Like my dad is like very much like, no, you need to make this much every day to be able to, you know. And then my mom like calls me on the side and then she's like, okay, we're giving you this money, but you need to make sure that you also help people who won't be able to. And you'll find your way and you'll figure out eventually what works for you and what doesn't work for you. Lots of different ways. What I do is also most of the time, because I actually love kids. So when the kids are coming in, more often than not, it's either with, you know, the nanny or whoever. Like when you're doing your oral hygiene instructions, include them as well, because it's stuff that they can also take and, you know, implement in their own families and so on and so forth. And then also when it comes to them needing it, instead of going to stand in a queue at a clinic somewhere, we actually do give them sort of preferential rates, you know, sort of our patient base when they do bring their helpers, their gardeners, and whoever, definitely do try to help that way. And then patients who have been there for a very long time as well, you know, when they go and sort of become pensioners, you know, you basically will find a way. Definitely at the beginning, you're still going to be trying to find your feet. And then eventually, you know what you want to actually concentrate on. And then, you know, and it definitely there's lots of ways that you can give back. And I think also one of my patients, I'm just going to give an example with COVID. I mean, she was regular, like on the dot. You could actually just like, you know, no, like 6 months without fail, she's there. And she lost her job during COVID. And I remember telling her, you know, it's like, it's fine, just come when you're 6 months or up. Because when she came, she told me, she's like, I think this might be my last month and whatever. And then she was like, okay, fine, I'll come. I'm like, no, you've been coming for so long. The least I can do is do your normal checkup and cleaning. 2 years went by, we just check up on her and she's okay. Eventually, as soon as she gets a job, like literally when she signs the offer, she books for the following month. And then she comes in, she was like, you know what, she's just worried there might be, you know, something wrong. But the thing is, she already had such a great foundation that she clearly maintained it. She just didn't have a professional cleaning and stuff. And I mean, stuff like that. And then how did I reward her? I told her, you know what? Take the money that you're going to pay me today. Go do whatever it is that you haven't done, whether it's your hair, it's your nails, or whatever. You also just have to have, it motivates people because at the end of the day, it is word of mouth. And if you can do something that makes you feel good, because there's no amount of money that makes you feel good. There's some people who don't feel like that. They, you know, they couldn't be bothered. But for me, there's no monetary value that I can put on just being able to give back and just the thankfulness and the loyalty that you get. And then the fact that they go and they tell so many other people, it pays itself back. But you need to just find that balance and then you'll definitely be able to find your feet. But I definitely agree. We have to be able to be the difference. We can't wait for somebody else to do it. We can't wait for the societies to be able to come in and whatever. And if you can also approach people who will be able to allow you to go into schools, into orphanages and stuff like that, just to be able to just help out wherever you can.
Thank you. Adnil?
Yeah, I think we need to face the reality of what's happening in our country. There are people who graduate, and I mean, I had some friends who could save about 300,000 rand in ComServe, and I just managed to save up enough to pay off my student loan debt. That's unfortunately then stepping into post ComServe. There's someone with plus 300,000 rand and a car that their parents bought for them when they were a student and everything. And starting up and buying yourself stuff from that point, you're already starting on a back foot. So it is incredibly unrealistic to catch up, but it's definitely possible. It just comes with proper financial management. It comes with prioritizing the correct things. You can either choose to invest in equipment, or you can choose to invest in your in your expertise and in your knowledge, which I would 100% recommend. Before you go out and buy yourself a fancy new endo motor, rather go to the endo course first. And I tested this theory the other day. I had this pack of files. I'm not going to mention the company's name. There's a lot of people on here. And I just said, I'll never use this pack of files. It's cheap files. It's never going to work. And I had this patient come in who fractured a crown, and we decided to do a root submergence. So basically, we do a root canal, but we completely bury the root underneath the gum. The periodontist would do that afterwards. And I told the patient I'd do it at a reduced fee. Obviously, I don't need that much. I can't really apply rubber dam. There's a few things that I can't really do over here. And I told him, like, listen, I have these files. They're brand new. I want to test them out. And I used them, and they worked. And that's because I have done years and years of endodontics now, and advanced endodontics, which allows me to, even when the equipment's not great, or even when the material's not great, it's still possible. So even if you can't afford to buy the best materials or buy the best equipment or whatever, it's still possible for you to do very, very good work. So it's not just because everyone has a Dentsply chair or everyone has a Belmont Plest or whatever, doesn't mean that you need to have one. A chair does not make you any money. So don't spend all your money on a dental chair. Yeah, that's my advice. Yeah.
Thanks. Marcia?
From my end, I'll reiterate is, again, try and just invest in yourself, like what Dr. Koch mentioned, as much as you can, because when you have a passion for the work that you do and you are committed to being the best that you can be to your patients, that is how your practice will eventually grow. And like Dr. Sandrine said, like the more you give back, you just see it come back to you tenfold. So what you mentioned about wanting to give back to the community is if you can find a way to factor that in as soon as you start earning, whether it be just like Prof. Engelpaul said, like even if you take some time out and you visit a preschool, give them all hygiene instructions, you start off small, those things come back to you because by word of mouth, people are like, well, that dentist is actually taking an interest in us, it's taking an interest in our community. Let us just go see what she's about or he's about. And then from there, that is when your practice will slowly build up and all the kindness you give back will be returned. So, yeah.
Thanks. Yeah, I think also like tech doesn't necessarily make you a good practitioner. You can have the fanciest scanners, the fanciest camera, but it doesn't mean that your prep's good. So like everyone's saying, I'd rather spend the time on developing yourself because I don't know how long they give you now, but sometimes it took me an hour to do a prep in varsity, right? And then you still get your prof or your lecturer or your proctor saying, this is terrible, go back and do it again, kind of a thing. And that was on a Frisaka model where there was no implications at all besides maybe nicking a little bit of the gum. So I think, there's that pressure of delivering as well as improving on your skill. So that's where tech helps you become more efficient. It doesn't necessarily make you better. You still need the core skills to be refined into whatever niche you want to go to or whatever your focus needs to be. Like I said 3 times before, the tech does not make you a better practitioner. So don't worry too much about the tech in the beginning. It'll come. Get the skill. What if you get the endo modes and you realize 2 months after ComServe, you actually don't like doing endo? I feel like often we glamorize certain aspects as students, and it's largely based on your experience with the prof, the lecturer, whatever, or the patients you had. You're like, so I'm going to be a max fac. I can tell you now, most people that used to say that in my year are very far from max fac. It's whether it's not semantics that they couldn't get in or not, it's because things are beautified. Like you see that prof walk in, that's a max fac, you're like, wow, that guy's got grace, that guy's got poise. I want to be that. And then you get out in the real and you're like, this is actually not for me. So I think, tech is one thing, skill is one thing, knowing where you want to go is another thing. And unfortunately, a lot of these things are very specific. Like you're not going to go buy a microscope to do extractions, it's those kind of things. You have to figure out the what before the what do I need, and largely that basis on skill, like everyone else has said before. Jamila, do you have a next question for us then? You're on mute, just in case.
Yeah, actually, I do have a question, but I'm gonna jump on what you said when you're talking about how we speak about you want to be this while you're still at, like, in dental school, and how sometimes we are advised to sort of have, like, how can I say it, like an idea of whether you want to specialize or not, whether you want to go into private or not, or whether you want to be someone who gives back to the community, right? So my question here will be, as like people who've been in the industry for a while, what's your take on specializing versus having like a strong general dentist or general practice in South Africa? Because I think you pointed that out, that we sort of glamorize a lot of things before we actually see what it is that we actually like, because of how we are maybe idolizing people at school or like on campus, the professors and what they have and how they're doing it. And you maybe like a module and you're like, maybe I could do that. So I want to know, like, the take of the panel about specializing versus just general dentistry in South Africa specifically.
Andrew?
Actually, a very good question. I think Prof did allude to it. I think it was him at the beginning. The thing is, you will find your niche eventually when you're working, right? And even if you don't specialize particularly, because like Nate just alluded to, there's also obviously getting in, which isn't always as easy, but also just in terms of just being able to give your patient a better experience. And I think for me, I had gone so long without doing things that I didn't like because I would just refer. And then COVID hits, and most people either downgrade their medical aids or lose their medical aids completely. And then stuff that I had forever been sort of, outsourcing, because I was now just sort of concentrating more on the stuff that I like. Not that I can't do the other stuff, I just prefer not to. I just don't like it. And sorry, Dr. Cook, but Endo and I just don't go together. I'll like attend a lecture and then I'm like all pumped about it. And then I do like one or two and then I'm like, oh no, it's okay. Let's like leave that on the back burner. It also just gives you that confidence, because I think one of the things that I also wanted to bring up in the previous after the previous section was it was also so difficult to be taken seriously. First of all, I think as a female, and it was so much more difficult. Like you'd walk in and you're like, hi, so and so. Yeah, and I don't always say doctor, I just say I'm Sandrine, and how can I help you today? Oh, well, I don't want to repeat myself when the doctor comes in. Like I used to get that a lot at the very beginning. So when you also just have that confidence, when you literally know this is my thing, this is what I can do, literally, you wake me up from deep sleep and I'm able to literally just jump into it. It makes like a huge difference. And then whether you want to only do that for the rest of your life is something that only you can decide once you're there. Maybe doing it a lot and then from time to time being able to do something else. I also do quite a lot of special needs stuff. So sometimes I have to do things that I'm not comfortable with because that patient is used to me. They're not going to easily go to somebody else. So you definitely do need to still kind of know how to do everything else, but then just concentrate on one thing, I think would definitely help. And then to be able to just give the best. If you really feel that, it's something I don't really feel, just like, it doesn't even need to be to a specialist. Maybe your colleague, if you're in a partnership or in a center like we are, will be able to do the stuff that I don't, which works perfectly for us. Like, Michelle and I kind of are the yin to each other's yangs. And then you build a rapport also with the people that you refer to. And then you have this like great, and not just from a dental perspective. I do quite a bit of TMJ stuff as well. So like the physios that I work with, the Carious that I work with, like, literally just spread your net. And then your patients actually appreciate you knowing that, this is where like my limitations are, and I want the best for you. So let's go to X, Y, and Z.
I think I'd like to add on to that. I'd like to add on to that Mama, in a meeting. Okay, sorry, that it is actually so, like I said, it's so rewarding when you find the patients that want to refer to you, and like Dr. Sandrine said, where you know what your niche, you know where your limitations are. So you know, okay, at this point, I'm going to have to refer out. Your patients appreciate that honesty so much. So when it comes to deciding whether you want to stay a really good generalist or whether you want to specialize, it is really where your career takes you. You may find that you are you're having to broaden your skill set because you have a patient that just refuses to go to anybody else, whether it is because there may be a high anxious patient and they found love with you, and your skill set, it's just what appealed to them and you guys gelled. So that's why they will say, okay, I want to stick with you, and then you broaden your skill set that way, and you actually find that that's what you like to do and you enjoy doing. Or it could be that you say, let me take a shot at being a specialist because I really enjoy this field, and then you cast your net that way. I don't want you to limit yourself and say, oh no, you know what, off the bat, I either want to be a specialist, because even I would think that what makes a really good specialist is somebody that has a good general dental background as well. So going straight out of ComServe and trying to go straight into becoming a specialist is great. Some people, you can't afford that because you have to pay for your primaries. You're probably going to have to shadow people and maybe work without getting paid for a little bit. So you may not be. And if you're on a back burner with having all these expenses that you have to cover, then that, don't know what happened there. So you may have the thing where you need to like say, okay, well, you know what, you can't do that. So you go into general dentistry, and then in that way you broaden your skill set like that, and you'll actually see that, you know what, maybe this is something that you enjoy doing. So my advice is don't lock down on saying I want to do one thing and just narrow your path unless that's how focused you are. But give it a go and see where the path leads.
Hello, Prof. Anyone want to add to that?
Yeah, Prof, you can go. Yeah.
Yeah, no, I just think when you're starting off, you're entering a new world. You're a student, you're entering a new world. Just try the obviously look new in general practice. See how it goes, see what you like, see what you don't like, see how things are, see what attracts you. But I mean, specialization doesn't necessarily mean that you have to join the go through 4 years of training and become an orthodontist. And that's another. I'm talking about finding your niche area and the way dentistry is moving and the technology that for each, I mean, aesthetics is a good example. Everybody I know composite aesthetic dentistry, for example, people are talking about composites replacing amalgam. And the problem with the new composites is that you're still having issues of porosity, you're still having issues of sensitivity, you're still having issues of a whole range of offers. And then the main thing about this technique sensitive. And if you compare it to the newer options where you 3D print these zirconia or other materials using digital technology, the material is much more stable. You get a better finish. You get a better aesthetic outcome. And if you really want to give your patients the best experience, so even you look at some practices, good Mark Bowers that do composites, they spend 2-3 hours on one filling, and you may be wondering what the hell these guys are doing. But that's what it takes if you really want to play in that league. and that's how you have to develop yourself. Obviously, it also depends where you find yourself. You know, I mean, when I was in the middle practice, I was in a lower to middle income area. So most of my patients, you know, affordability was always an issue. So you also got to, you know, watch your service offering is also determined by where you are, the type of patients that come into your practice, your interest, your speciality. But I think also, you know, Nate was talking about technology and, you know, don't invest or generalization. But, you know, remember when patients come to you, their measure is not, okay, they are now much more savvy than how it was 20 years ago. They get impressed by the look, they get impressed by the technology that they see. But the most important, I think, item or measure for them is you. They don't look at you and say, wow, what a fantastic amalgam. You know, you signed your name on it and you got the carving right and you got the interproximal area clear and, you know, oh, wow, the floss goes in. What a great dentist. They don't measure you by those. We measure each other by those kind of things. They measure things on your touch, your tone, your temperament, remembering small things about them. How you know, I heard it was your son's birthday and I hope he had a nice day. Your ability to communicate and make them feel special. Those are the key ingredients to success. And I'm sure the guys that are already in practice here will attest to some of those things spoken about. Yeah. Thank you.
Thanks, Prof.
Yeah, okay.
Yeah.
I think for me, I very soon, well, in Comsov, I decided that I wanted to specialize in perio initially. Decided to get all my ducks in a row, started studying for my primaries, paid for my primaries, and was almost ready to go and write these primaries. And about a week before, I was working at the University of the Western Cape in the perio department and supervising undergraduate students. And in my free time, I would go upstairs and assist the registrars and chat to some of the periodontists. And I'd grown a very good relationship with most of the people in the perio department. And it was sort of, I guess, expected of me to apply for the next registrar post that was opening up. And about a week just before, I was about to write my primaries, and a week before, I just decided, like, let me just have one last chat with this periodontist who was mentoring me at the time at UWC, and she just asked me, am I ready to put my burrs down, and am I ready to put my composite down? Am I ready for that? If yes, come and specialize, and great, we'd love to have you on board. And apply, go and write your primaries, and we can make this happen together. And I just said, I'm not ready. Like, I don't think I'm ready to do that. There's still so much that I would love to learn in dentistry, about general dentistry. And a couple of months later, someone took a gamble on me. Sure, I can name him. His name's Ridwan Afji, owns Matrix Dental Specialist. He took a gamble on me and he just told me, like, listen, I can see you enjoy endo. I can see you're good at it. Why don't you come and see your endo patients at my practice, use my microscope, use my CBCT. And that's when I realized that I really enjoyed endo. You don't know what you don't know. You can't see what you can't see. So you don't know that I say this to fifth year students all the time and they tell me they love endo. I'm like, no, you don't. Work with a microscope, have a CBCT to see how many of your endos fail, and then you tell me again that you love endo. Only once you start seeing these things, your love for endo only starts. Once you have a microscope or once you have the 4 times, 5 times loops. It's unfortunate that this is a profession where we actually need the technology in order to do the good work. Those two things, a CBCT and a microscope, I would say 100%. But sort of pseudo specializing is a very good thing to do. And then going to specialize, I would say, between the ages of 35 to 40. That would be my recommendation. Yeah.
Yeah, and to add to Admiral there, I'm actually anti-specializing completely. And that's largely because most people do it because of social pressures. It's from your colleagues. I can tell you now, you ask 9 out of 10 patients, they don't know the difference between an orthodontist, the periodontist, the maxillofacial, oral pathologist, or they don't know the difference. So who are you doing it for if there's pressures? We also live in a country where with adequate training, your scope of practice is quite close to what a lot of specialists can do. You can't do the most advanced thing, but you can do a lot of the stuff that you do while still practicing a full scope of dentistry. So formal specialization is something you have to really think long and hard about. One, because you might get your dreams crushed, because you might not get in. And secondly is it might not be all that it's cut out to be. By the time you get into your second or third year, you might realize, hey, I can't deal with just gums and bone all day. I want to put the denture in. I want to do a composite. I want to do a crown. So it's all those things you have to realize as well. You don't have to have formal specialization to be good at it. You need a good mentor. You need adequate training, and do need the right clientele to make you do it often enough that you do get good at it. So I feel like there is a bit of a pressure to specialize. Some of the best implantologists I know have never specialized. Some of the best crown I've ever seen in my life is not from a prosthodontist. So I think it's the idea of it yet again being seen as one up from being a generalist. It is. I'm not taking anything away from anyone who specializes, but know that that is what you want to do. So if you want to never see a crown again, go and do a specialty that you never have to do. If you never want to touch composite again, go do a surgical one. So it's one of those things that you have to put your heart into it, otherwise you're going to get there and then you're like, well, now what? The grass isn't always green on the other side of the specialty. So it's one of those things you have to be sure, because you can get all the way 3 or 4 years. You don't have to write your final exams if you won't technically be a specialist and then go back to practice, but then you've lost 4 years of hand skills and the other things. So I'm quite anti-specialist, not in the sense that I refer a lot of work to specialists and saying that it is this thing that is being held on a pedestal for many, many decades, and it is a need for it, but not everyone is going to specialize. So don't put it up there as the end goal when you don't even know where the starting line is. Yeah. Okay. Katla, do you have a question there?
I think on the topic of just people that helped out post your graduation and after ComServe, people that came into your lives that were already professionals and either mentored you or helped grow you within the profession. On that topic, how do you think mentors kind of affect you post graduating and post ComServe? And do you think for someone who might be not necessarily networking or a bit of like a closed off person who is entering dentistry, how do you think that they would manage if they didn't have, or can you manage if you don't have that mentor or person that you're going straight to?
So can I answer this before I hand it over? I have this perception that you go out into the world and people come and they want to impart knowledge. That's unfortunately not how it is. You have to go and find your mentor. So pick wisely and invest time, because you're not going to get paid for a lot of the stuff that you learn from them, but the knowledge is invaluable. Prof?
I think there's a lot of mentors out there that want to give back, but again, fundamentally, it is about the type of dentist and the type of dentistry that you see yourself wanting to provide or wanting to be, and also a lot of it is as you go along and you learn and you meet and you network. That's important. Attending conferences is important. Attending courses is important. And then when you do this, you're networking and you're finding out and you're learning. And I think that's where you also get you develop your areas of interest, and you start mixing with like-minded people who will always assist you. There are lots of dentists that they don't see their colleagues as opposition, but mere, especially the senior guys, they really want to mentor you. So So move and join organizations. I mean, ASADA has this fantastic support systems that they have in place, the training courses, the ASADA conference, you bring in the top guys from all over the world that come share their experience and go and attend. You got to, like I think Dr. Cox said, you invest in yourself. You're the most important person. And what we teach in dental school is just the very, very basics. You remember, it's 5 years, and the knowledge and the amount of information that's out there, we just don't have the time to teach everything, but certainly give you the concepts. We're still lucky here in South Africa because there's two things we have here that the rest of the world will literally die for. We have the burden of disease and we have patients. So what our undergraduates learn here, even in the training, undergraduate training, even specialists in other parts of the world wouldn't be able to do. So we have the South Africa is the best place on the planet for medical and dental training. And then you have colleagues out there with tons of experience and tons of focus areas. We'll see more and more of the practices becoming differentiated in terms of the specific focus areas. The days of the one-man practice is still there, but yeah, it's coming to an end. You've got to be smart. You've got to think. I mean, dentistry is an expensive business. So you're getting, PTYs, you're getting franchises, you're getting group practices, you're getting joining other professions where you're part of a team. You have an oral hygienist, dentist, a medicine, medical guy in a community health center, and they all refer to you and offer a whole series of aesthetic dentistry is big. So there's lots of opportunities. There's lots of dentists. So you also got to, you got to come up with this to say, okay, you know what, there's 10 dentists around me. How can I differentiate myself and offer something that's different so that people will come to me? When I was in practice, I was in an area where there was about 7, 8 dentists within a 2 square kilometer area, and I was the newest and the youngest graduate that was there. So I had to say, okay, these are experienced guys. They got lots of patients. How do you differentiate yourself and sell your practice so that your people are attractive? And one of the things that I was successful at, I had good interpersonal skills. I made patients feel very comfortable. I remembered important things about them, and obviously it's again the word of mouth thing. So it's not easy out there. It's a business opportunity. Dentistry is expensive. The capital outlay alone now, I think for a decent startup practice, you need close to $1 million. So that's why I always tell you guys, the ComServe, you immediately come into ComServe, you earn 600,000. The silliest thing you can do is go and order that BMW because you need to be in the crowd. Invest that money, pay off your debts, use some of that to capitalize your practice, and don't be afraid of debt also. I mean, if you don't have money, go to the banks, and pay, and you will pay it up over a period of time. But that's what it takes, and do all those things. Commit yourself, and yeah, you'll be fantastic. You'll be. Just don't forget where you come from, and you'll be okay. Thank you.
Andrew?
For me personally, definitely, because mentoring isn't even just from a purely dental perspective. There's practice management, there's your taxes, there's whether you're an employee, because some dentists, unfortunately, are basically just there to exploit you if you don't know what you're doing. So one of the things that I do for part of my giving back is also to do some sessions in a public setting, and then come into contact with ComServes. Basically speak to them about, like Prof just said, don't be scared of debt. You need to build up a good credit record, but just don't be careless with it. So usually it's like, okay, you know what, like maybe whatever it is, but you need to be in a position where you're able to pay it off and actually pay more, because you need to be able to do that. And then you can go and you can get your home loan and so on and so forth, because you need to start somewhere and you need to start wisely. So mentoring can be from any perspective, and then you will definitely find your crew. You get some people that are definitely there to help, and then you get some people that are literally just looking out for themselves and will abuse. So definitely, look around and then see what works for you. But like I said, it's mentoring beyond just what you're thinking of, because once you get there, there's like so much that you're exposed to that we don't learn in undergrad. It's such a limited period, but you need that to be good. You need to be a good clinician, to be a good citizen, to be a good, like in any other thing. So definitely for me personally, I definitely, I would recommend trying to find somebody who would be able to just help you, and then you find your feet, and then it's somebody you can always, use as a sounding board, and just, call them up. And obviously the more you grow and develop, you won't be as reliant on them. But then once in a while also just to be able to just call them up and ask a question. So for me, that was very important. And I think the most important thing as well that I also learned from there was how to treat your patients. And it was something that I wanted to add even in the last one is make notes. Sometimes it's very easy because especially when you have patients that come, families and stuff, you don't need to make those notes anymore. You're able to just remember they were going on a trip. This one had a rugby festival before them. And I promise you, just to be able to say that, like patients will be like, how on earth do you remember? Like I've already forgotten about that trip. And to be quite honest, some patients really are sent from that fiery place down below, and you don't want to remember anything about them. And in some of them, it will literally just come like literally so easily, and you'll be able to just remember. But it really does make them feel very comfortable, and then they actually want to come back. And so I would definitely recommend that. Personally, I benefited from it, and I'd like to think I'm helping other people navigate their way and also find their way.
Thank you. Marcia?
So your question was about mentoring and like finding the right mentor, as well as if you are not really, maybe if you are more introverted, like how do you find your feet? So I'm going to answer the latter first. And if you are introverted and you're a dentist, I think maybe some patients would like you because you're not talking to them whilst their mouth is open. But for the most part, you are not going to, you are going to struggle in a sense of if you don't grab the opportunity, it's not going to get handed to you on your lap. So for every bit after you graduate that you learn is just going to make you a better practitioner and a better person. You need to go out and get it yourself. So as an introvert, that is a skill that you are going to have to learn to develop. Nobody's asking you to be the loudest in the room. Nobody's asking you to be the most profound in the room. What we are asking you to do is, as a healthcare practitioner, and you want to put your patient first, go out there and, if not, challenge yourself to say, well, I'm just going to keep learning so I can be the best for my patients. And then in terms of finding a good mentor, like get in touch in private practice, get in touch with the dentist in private practice. I have a lot of students that literally reach out to me and be like, hey, would you mind if I come and shadow you for a day or two in private practice? And it if you don't ask, you will never know. And back to what Dr. Sandrine said about your mentor doesn't necessarily have to be your it doesn't necessarily have to be a dentist. It can be, for example, nobody realizes this. Well, I know, not for me, I didn't realize just how much of a business dentistry was until I got into private practice. Yes, we are a service provider, but we are also selling a service. We also have to eat and feed our kids, right? So your mentors can be something as people that are business coaches, or people that have been in private practice in other healthcare disciplines, or somebody like nowadays. Everybody is on Instagram, on social media, even if it means a mentor that helps you speak better, helps you to get more comfortable with people that you don't know, so that you can actually come off a little bit more friendly towards your patients and be inviting that way. So it doesn't necessarily have to be another dentist. You know, that yes, that is a great skill set. I mean, that they will impart on you, hopefully, but being a dentist in private practice is so being a dentist. There's the business side, there's the social side of it, and obviously the skill set that comes with that. And you're just gonna have to, you know, push through and keep learning. So yeah, that's what I want to add.
Admiral, you have something to add?
Yeah, I'll just add something shortly. I think for me, I would say I've had about 6 or 7 dentists who have just completely changed my life. And how I did this is I had this vision of building this crazy vision of building this multidisciplinary practice here in the northern suburbs of like overlooking Cape Town. And I thought to myself, who are the dentists or who are the specialists that I would need in practice to build this absolutely perfect multidisciplinary practice? And I identified exactly who would it be that I needed. And those are the people I then decided right then and there, I'm going to message them. This was 2 years post-concert. Yes, 2019, I think. 2021, I think, yeah. And I just decided to message them all and tell them, listen, I love your work. I love what you're doing. And can I come and watch you work? I made the time to go and watch them. I made the time. I went and assisted Ridwan Afajini's practice. I went and assisted Jean van Leerop, Corné Smith, and an orthodontist in Tableview, Marius Kutsia, as well as a MaxVac in at Louis Leipold here in Belleville. I went and assisted them, and I wanted to see what they do. I wanted to see how they speak to their patients. I wanted to see how they tell a patient, listen, your treatment is going to cost 100,000 Rand. Does the patient, why do their patients not fall off the chair? But when I tell my patients a root canal costs, well, back then was like 6,000 Rand, they fall off their chair. What is the difference between us? What did they do right in their careers that made them end up where they currently are? And I wanted to figure out that secret. And I can say for the past 4 years, after these 4 years, they still help me. They still guide me. I obviously work for Corné Smith and Jean van Leerop now. But having a mentor means you need to step out of your comfort zone. It means that you need to it doesn't mean that you need to say all the right things or that you need to bombard them with information. One thing I can tell you is that apparently some people see me as their mentor now, which is absolutely crazy because I still need a lot of mentorship in terms of endo. But one thing that I absolutely despise, and I can say that honestly now, is I do not want to go to a SADA meeting or go to a lecture where I'm not lecturing and you bombard me with photos of x-rays in my face. Or you like, yeah, look at this, look at this, look at this. That is the wrong approach on how you're going to get someone to mentor you and someone to share information with you. The correct way would just be, firstly, they are human. Send them a message, either on Instagram or on WhatsApp. As soon as you send them a message on Instagram, just ask for their WhatsApp number. I give my WhatsApp number away freely. I'm very, very happy to give it to 163 people on here. Never mind. I I would be very happy to help anyone who needs my assistance with regards to endo. Yes, I won't be able to respond immediately, but maybe the next day I will be able to help. People are a lot more friendly and a lot more helpful if you just act absolutely normal around them instead of making it this big deal. Yeah.
Agreed. Okay, so I want to switch it up a little bit and let's start with Sanjina. Sanjina, is there any question that you actually want to ask anyone on the YDC or any of the students that you think, but maybe you've always wanted to ask or you feel will add to the conversation you're having?
I think one of the questions that I've had was answered through the course. I wanted to see sort of what is the difference with when I graduated 20 years ago versus, like for instance, what Jamil is going through now. And it's kind of sad that it seems like it's still the same, because I remember I missed the only implant thing we had, it was on a Saturday where we went to Southern head office and I had to attend a funeral. So I basically went into private practice having no idea what implantology was all about. And it's very sad that it kind of sounds like it's still the norm now. And I think I definitely wholeheartedly agree with what Prof was saying. We need to find a way to make it a little bit more sort of not futuristic, but we need to look at where the profession is now and try to make the undergrad like prepare us, I think, a little bit better. Because like I said, it is also very difficult to be able to find somebody who will be able to really sort of guide you through and help you find your feet. But yeah, like Dr. Cox said, just try until you find somebody, because I don't know how many people who get given these ridiculous contracts. Like, you know, they're going to be paying them 35% and they must still pay their own assistant and they must still pay their own. I'm like, that's insane. Like, what do they expect you to take home when you do all of that? Like small little things like that. It's not the norm. But the thing is, you're like, oh yes, I went for an interview and I got this grade. No, it's not. They're doing you wrong. Like, you go back and then when they realize, oh, you actually spoke to somebody about this, and then they're like, okay, well then, you know what, maybe let's do 45%. We'll cover the assistant, we'll cover the materials. So small little things like that are extremely important. I think that was the biggest question that I wanted to find out. Like, has there been a change in the way that we are training, you know, the students? And I think that question was answered during the course of this evening. And it's sad to say that clearly not much has changed.
Well, I'd like to jump in there and say, like, part of where we're trying to redirect as the YDC is to be that change from an external force. It is going to be a process. You know, change doesn't happen overnight. So part of the direction we want to head is be basically a bridge, for lack of a better word, not a removable denture, but a bridge. And we want to be able to add a little bit more guidance, because and I'll be honest, the reason I actually sought to join, and I think I expressed this in one of our branch meetings, I joined the YDC because I felt there was zero direction post-college. Your hand was held all the way until graduation day. I ended up in a post where there was no supervision. So from that day, I had zero guidance. It was up to me. And that was my personal journey as to what got me here. So I see that, and it echoes. It echoes from 20 years ago. It echoes. I'm sure tomorrow it'll still be echoing. But it is, if we don't invoke that change, it's never going to come. So I think that's the direction the YDC is taking. It'll probably take a few years to get there. I'm aging out of the system, so a lot of my colleagues will carry on the reins. But that is honestly what we're trying to fight for in terms of the direction.
And I think
Prof, do you have
to add, sorry, Nate. I just want to add along that, because obviously YDC did not exist during my time. And I think it is definitely crucial. Because I think we probably had a lot more to figure out on our own because there wasn't this. And I think even from a SADA perspective, I've been a silent member forever and a day because I didn't even know what SADA actually offers me as a dentist. And I think also to just be able to have that transitioning phase. I mean, you definitely are a colleague from the time you graduate because you're literally the same as the rest of us. Like I said, we're forever learning. But just to have that to help you navigate waters, it's such a huge thing. So I definitely, big ups. I think you and your colleagues are doing an amazing job, and may you continue to do so for all our future colleagues in the making.
Thank you. Before we go to Prof's question, I see Katleo's got a hand up.
Yes, I also wanted to speak on bridging that gap between the youth and actual professional dentists. I think I can speak for most of my colleagues and friends in uni, and that it feels like dental professionals are so far and so distant and almost like unreachable when it comes to communicating and getting a sense of like advice giving and mentoring. And I think especially in the earlier years of university, it just feels like it's just a dream still. And going to a doctor and actually like asking them, doctors that have their own practices and like are outside of university, asking them questions and understanding what's going on, it just feels like such a far stretch as you're still like on your journey. But I do think forums like this and platforms like this really bridge that gap, because it just makes those dreams that we have at this age so much more attainable and so much more realistic. So I think not only panels like this would obviously give insight into the degree, but it could be the difference between someone studying and dropping out, or study, or seeing like an actual example of their role model talking and actually mentoring them. So I think they're very useful, and I honestly think the way going forward is to have more of these and have more student interaction and forums like this and in-person tutorials on like certain procedures from a professional perspective, because I do think there's a large disparity between the private sector knowledge that's gained as well as in public sector, and in the public sector and in education. There's a big disparity there. So closing that gap would help a lot.
Let's hope we can. Prof, you have a question there?
No, I don't have a question, but maybe just to add to. So I mean, from the training perspective, there's just two things. The first thing, obviously, is the volume and the amount of new knowledge that's coming in, and the limited time that we have. But that's still not an excuse. So from the training perspective, we've also got to now read the landscape, see what's new, what's how the profession is changing. And I spoke to you earlier on this digital change that we're also trying to introduce in dental schools. But we also got to be innovative. I mean, so what's stopping us, for example, from setting up programs or teaming up with SADA to say, what, some of our final year students spend some time in private practice as an elective, for example. Go and learn, spend some time. We can easily build up into our systems. It just takes planning. It's not, you also have to sort of accredit these practices with the HPC, but it can be done. And so, I mean, I've listened to the feedback here, and I'll take the comments positively and go back to dental school and say, listen, this is a client that's out there. Can we also, so like I said, I keep on using the word fit for purpose. If 99% of our graduates are going to end up in the world that you are in currently, which is the private sector, we've got to move in that direction with our patients. And I'm not saying for one second that we must ignore that other big need of access, equity, serving the poor, etc., etc. I mean, you don't forget that also, but also you got to train for the other reality also. So that's why I use the term, our students have to be socially responsive, but also globally competitive, keeping up to date with the real. And that's what makes South Africa the most fantastic training environment in the whole world. Thank you.
Thank you, Prof. There's just one thing I wanted to also add there. We are often driven in private practice by this big corporation called medical aids, which I feel like we as a profession have let ourselves down, because I think the latest statistic I saw was 16% or just under 16% of our whole population has medical aid. Now, over the years, and I haven't been in practice that long, the dental cover is a very small percentage of those patients either as well. So we can't also undersell ourselves to medical aids. We can't also give in to the everywhere, and it is something that we have to stand for as a profession, because yes, it's all good saying, but that's where the patients are. But the patients are there because they don't actually understand what a medical aid is. They think, I pay for this thing, I should get everything. So I feel like medical aid dentistry has let us down in many respects. So I think the average increase annually is, over the last 20, 30 years, is somewhere between 3 and 4%, and where true medical inflation is sitting somewhere closer to 8%. So I feel like we as a profession also need to take a stand as what is acceptable for us, not letting an outside company that has no idea actually what things cost to practice decide these factors. I think that is a big driving factor into some dentists' unhappiness, is because they're like, I'm seeing 20 patients a day. How many more can I see? But I'm still only just making ends meet. So I feel like that is a big thing that we also need to stand for as a profession. And the only problem with that is we have to stand united. Because if we don't, if there's one, I'm going to use the word weak link, no one take offense, but if there's one weak link in that stance, the whole idea of what we want to stand for as a profession does crumble. And I think SADA has been behind this fight for a while, but the problem is the everyday dentist is not behind it. So I think that that's just one thing I also wanted to add is because when you pressed for time because you have to see 20 patients, you're not going to develop your skill. You're not going to find your niches easily. You're just trying to pay bills. And I feel like that is a rat race that if you find yourself in that position, it is very difficult to get out of it. So as much as we all need to make money, we need to also find a way that it makes one accessibility for patients and we're giving good quality of care. If you're doing a filling in 15 minutes, I'm not too sure how good a filling can be if you could have spent 40 minutes doing that same filling. So I feel like we need to also gauge that. And that's a big part of starting a practice, finding your niche, working as a locum, that you need to figure out. Because most of the time you do one filling in a session, unless I was a very slow student, you do one filling in a session as a student and you're like, cool, I got the quota, let's carry on. You do that in a practice, you've lost 600-700 Rand worth of chair time. So I think that's also something that I wanted to add and wanted to make sure that we were able to, I could squeeze it in some way before my punt for any young dentist under the age of 35. Please, please, please sign up to the YDC. It is free if you're a SADA member. It's just a little thing you have to click. It goes to the HR, PR, whoever handles it at SADA, and you get logged on there. Because the higher the numbers we have, the more of these things we can actually have. The more webinars, the more inputs we can get, the more voices in this conversation, rather than just drifting along in the profession. Yeah. And Jamila, I see your hands raised there. One last question, so we're almost out of time.
Okay, so can you hear me?
You faint, yeah.
Okay. So I just wanted
Yeah,
to
there
add
you
to
go.
something like Dr. Sandrine, like with her question about how things have changed and whether they have changed or not. I feel like to some extent there is some change, but yes, there's still that gap that we still feel as students, where you still feel like I'm going out into the world, as now the professional, as now the decision maker, and I'm most probably going to be put in a place where I'm going to make decisions on my own. And because my hand has been held for so long, where I have had to show someone my work before I even am confident enough that what I did is good enough for that patient, right? I think that gap still needs to be filled. And I think platforms like the YDC could help in those instances. And I think that's why we have the SATSA that was formed, my belief, for that being formed was to try and bridge those little gaps, like to find ways to work with the student association and a professional association and find ways to come up with either programs, workshops, or hands-on how can I say, skills that maybe the school does not offer, and outside of the school where a student can actually learn how to do something and be confident enough to say, okay, in the following year, I will be able and I will be a competent dentist out there to be able to help anyone who walks in without having to question whether my work is good enough. So I want to sort of ask the YDC to be open to having workshops with students, if it's possible, having like weekend or even holiday workshops where we could learn from the young dentists, because the committee is made out of young dentists who are like 35 and young. I don't even know how long I'll be in that committee because I'm quarter to 35. So yeah. But yeah, so if we can have such platforms that helps us outside of the school, I think that'll be the most beneficial thing for us and probably make us even more proficient. So yeah.
That is the goal. That is definitely the goal. And it is difficult to change things in corporate structures, which SADA is. but we will fight the good fight until you come and join us. And I think it is one of those things that, it's very often that there's very few voices in the YDC. And we see this in the Exco quite a bit. And that over the years, I think the voices dimmed a little bit. So I didn't know what the YDC was until one of the ex-presidents and I had a chat, and I was like, oh, okay, cool. That sounds amazing. That sounds exactly where I want to be. So I think that we want to invoke this change. And I think the more input we get from the student council, and as well as from like institutions like with Prof, if we can get in that on that engagement level of where say this is what we want to actually set in place, it'll be a lot easier than actually just trying to infiltrate the universities on our own. Because at the end of the day, as much as we do want to make change, we still have either jobs or practices to run. So it's not as easy as it seems. It's not like this is my job. My job isn't to just run the YDC. It's I still have to put food on the table for my family. So I think the more voices we have, the lighter the work. And if we have institutions willing to engage, it'll be amazing. And that's also, I knew Prof would have a lot of insights, and that's why he wasn't one of the panelists here, because he's got a lot of knowledge in this sphere, and he has a position where he can actually take back some of the feedback and go and implement it. I'd like to say tomorrow, but I know change doesn't happen that quick. But he can start implementing change whenever possible. So I think in the future, we should have more of these discussions. We are out of time as well for today. So I think this is also in closing. I believe that there are a few unanswered questions. There are way more than a few unanswered questions, but I feel like this is a nice form of engagement where we can start opening doors and we can think of where we need to go as SADSA in conjunction with YDC and SADA. Without these conversations, we kind of assuming what is required of us and assuming what the general populace is desiring the information on. So I'll give an example. I can only talk of my own experience and what my friends tell me. I have no idea what's happening in Western Cape. I have no idea what's happening in Limpopo. So we can have, the more voices we have in this conversation, the better. So I think this is a good start to that. And I do hope that we have many more of these webinars, potentially not for the next couple of months because we have Congress coming up. So focus should go there. But after that, we want to have a little bit more engagement with the students, and we would like senior dentists and younger dentists that aren't part of YDC yet to one, join and also be involved in it. So I'd like to thank each one of the panelists tonight. I hope it was as insightful for you as it was for me. Thanks to everyone that joined us, all 155 of you that are still here, thank you. And we will meet again, and I think we need to get different topics going as well. So we can have an evening on a set topic, for example, how to find a mentor, and we maybe even initiate a mentor program. So I think when we see a need, we have to pivot and we have to find out a way how to make that work. So thank you all for joining me and the team. Thanks, Prof. Thanks, Sandrine. Thanks, Adnil. Thanks, Masu. And Jamila and Katel. All the best for the rest of this year. I think it's almost over. I can't remember how varsity works. But strong, and we will see you in the next one. Thank you, guys.
Thank you.
Thank you.
Thanks and good night.
Ciao, ciao.